It shows a pattern of Dr. William Husel overriding warnings and bypassing approvals by pharmacists to order excessive doses of pain medication for patients in his care.
NBC4's Ted Hart has a closer look at those findings. Ted.
Yeah, the Centers for Medicare and Medicaid Services had asked for the inspection, and it has now accepted Mount Carmel's plan to correct its problems, but it all shows a troubling history of system failures. The hospital inspection report found that Mount Carmel West failed to ensure a system was in place to monitor and prevent large doses of central nervous system medications from being accessed by overriding the warnings and prior approval from the pharmacist. The hospital fired Dr. William Husel as an internal investigation determined that he had ordered excessive and potentially fatal doses of pain medication, primarily fentanyl, to patients in the intensive care unit. The inspection shows time after time the excessive amounts of drugs were accessed by overriding a medication dispensing system. The report says the chief pharmacy officer was unable to offer any information explaining how staff had been able to override the automatic medication dispensing system for a long period of time to obtain high doses of central nervous system medications with no pharmacy approval or intervention. As part of its plan to correct the problem, Mount Carmel has reduced the number of all medications available for override by approximately 55%, and it now requires daily monitoring by pharmacists of all high-risk emergency overrides. Many of the patients affected were given the medications in connection with removal of a ventilator. The hospital plan allows for morphine, Dilaudid, and Versed to be given in a specified range of doses. Fentanyl is not listed for use now. The hospital's new policy requires any physician to get permission from a medical director or a vice president of medical services for the use of medications outside of the dosing range. And the Ohio Department of Health has already conducted follow-up inspections to ensure that the action plan has been implemented. Of course, at stake is the hospital's status as a Medicare provider. Local for you, Ted Hart, NBC4.
Of course, you at home. Thank you so much, Ted. You at home can read the entire correction plan that Mount Carmel submitted to Medicare. Just visit our website, NBC4i.com, and click on the story.
Tonight, another family has come forward with their story of how their loved one died at Mount Carmel Hospital while under the care of Dr. William Husel. They're joining more than a dozen or dozens of others who filed wrongful death lawsuits. NBC4's Dan Pullman is live outside the hospital tonight with this new latest story. Dan.
Well, this latest filing is the 16th wrongful death lawsuit facing Dr. William Husel and Mount Carmel. I want you to go ahead and take a look at your screen. This is Sanders Young Jr. along with his wife, Helen. It was 2016. The attorneys for Young's family say he was a patient here in the Mount Carmel ICU where his condition worsened. This is where the lawyers tell us Husel ordered a 400 microgram dose of fentanyl as well as a dose of Dilaudid. They say the 67-year-old died 20 minutes after it was administered. Now, this case, along with the 33 others, is noted in the plan of correction Ted just told you about. At 11, I'm going to tell you what that plan says about this specific case. Local for you.